Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time.
Welcome to the Brain People Podcast. I'm Amanda Anguish, a licensed marriage and family therapist, and I am here with one of my favorite people, my coworker, and I'm also interviewing her today. And I'll let you introduce yourself.
All right. So my name is Charinette Gamboa. I'm a psychiatric nurse practitioner here at Beautiful Minds. And yes, I've been working with this great person here, Amanda, ever since, I think, 2019. So it's been great.
Yeah. So Charinette is here because we're going to talk about ADHD today. So a lot of people, I'm sure every single person listening and watching with us today has heard about ADHD, but we want to give people a little more insight into it. Sometimes it's nice to know about something a little bit more that we've heard about a lot, but maybe we don't fully understand it. I know there are a lot of things in my life I hear about them, but I'm like, oh, it'd be really nice if somebody actually explained this to me so that I'm not a little lost. And I've been working with teenagers since, I think 2008. And even before that too, but specifically with group home kids. And I remember it's probably the most diagnosed disorder that is given to young people. And I think just about every single one of the kids that I worked with in the group home was diagnosed with ADHD. And so I thought it'd be nice to have Charinette come along and share some of the things that we might want to understand about it, because I know a lot of parents might be wondering, like, should I take my child to the psychiatrist or the doctor to get diagnosed? Maybe my husband or my wife is acting a certain way and maybe they have ADHD too. So let's start out with what are, like, a basic definition. Let's start out with that. A definition. Yeah. What is ADHD?
So ADHD stands for Attention Deficit Hyperactivity Disorder. And according to the diagnostic DSM-5 criteria, you need 6 or more symptoms of hyperactivity and inattentiveness. So inattentiveness could include being disorganized, unable to stay focused, easily distracted. They lose things a lot. They're not able to complete their tasks either at home or at work. And then for hyperactivity, they're restless, fidgety. There's also impulsivity along with that. Some people procrastinate. Some people say, I'm really good at multitasking, excessive multitasking. So those things, or even problems with time management, being chronically late. So these are the criteria for those things. And so it's really important to understand that a diagnosis of ADHD usually stems before the age of 12 years old.
Okay.
And so I know I'm seeing a lot more adults with problems of this, and they said, well, I was never properly diagnosed as a child. So we have that as a way of realizing, okay, you weren't diagnosed properly. Let's look at the overall symptoms that you're suffering right now.
Okay, so I want to take a step back because you put a lot of stuff, and I want to unpack it just a little bit.
Yeah.
So we used to call it ADD,
right?
But now we call it ADHD. They kind of just put it all together in one package then? Okay.
Now I think they wanted to separate, and so you can have a diagnosis of ADHD predominantly inattentive or predominantly hyperactive or combined type.
Yeah, because I remember when it was ADD or ADHD, and now it's all ADHD, but predominantly inattentive. And you named some of the symptoms of that, or the symptoms of that, and then predominantly hyperactive. So you can have either one of those or both combined, right?
Exactly.
Okay. And then you did give us some of those symptoms, or most of those symptoms and stuff like that. So, okay, that's a good place to start. So a lot of people, I'm sure, want to know, well, you said it starts, usually they get a diagnosis before age 12. What are some of the things, though, that might contribute to that? Because I know, a lot of parents are like, well, why did my kid get diagnosed with this? Or why is my kid this way and have these symptoms? So
Right.
what can you tell us about that?
I think what we see the most that mimics it is trauma.
Mm-hmm.
Right? Children or adults who've had childhood trauma can present, or maybe their home environment is either violent or disorganized. These things affect the ability of the child to be able to focus and to do the task, because all they're trying to do is to survive.
Yeah, that's actually one of the things I noticed with my kids in the group home. A lot of them were diagnosed as ADHD, but when we looked into their family history or their life history, we noticed a lot of, the ones I worked with at least were in gang neighborhoods, had all serious kinds of violence that were going on in their homes and around their homes, even like gang activity or criminal activity at school and that sort of thing. So I know one of the symptoms of PTSD, which is post-traumatic stress disorder, is this hypervigilance.
Right.
And so if you have hypervigilance, you're not going to be paying attention to your schoolwork or whatever task that's been given to you. And also, too, that it's a heightened anxiety. So how can you focus on anything when you're thinking about something bad might be happening?
Yeah, exactly. And also think about it. You're in a traumatic situation. Sleep is probably a number one thing. When you're deprived of sleep, I think any one of us can present symptoms of inattentiveness and hyperactivity because our body is not getting that proper rest.
And that goes to one of the symptoms of PTSD is also like nightmares and terrors, night terrors and things like that. So if you're not sleeping, obviously, then you're not going to be attentive or focused and that sort of thing too.
Yeah. And that's how I think sometimes we forget that part, and so it's really important to look at the holistic gamut of where the patient is coming from or the individual, and see how their home environment is like, and even also if, let's say, if the child observes the parent to be more anxious or more maybe ambivalent. So they kind of, that's nurturing, right? You're mimicking
learned anxiety and learned hypervigilance and that sort of thing.
Exactly.
So,
yeah.
And I know you're very good about getting a very thorough background on anyone that comes in for any kind of diagnosis or any issues and stuff like that. So I think that is helpful for our listeners to know, like, make sure that whoever is seeing your child or you are seeing yourself, that they get a thorough history to know. So we talked about trauma being something. What else could be a contributing factor to ADHD?
Well, sometimes it also could be medical reasons. Let's say if your thyroid, is abnormal, right? Hyperthyroidism, that can affect your ability to focus. So there's that on the medical part. And also, number one, that I think it's slowly spiking, the diagnosis of ADHD is electronic use. And we didn't really see that back in the 80s and 90s. I mean, I was born in the 80s, so I'm giving out my age, but I'm realizing we played outdoors, we did things and we were interactive, and then bam, you get a flip phone and you're like, what is this all about? And then screen time is there. So that's, I think, the main, I'm not saying, media is bad or screen is bad. It's just the overuse of this can cause the overstimulation of the brain, where the brain is saying, I can't handle too much, but I'm going to try to cope with it.
Yeah. And I just read an article or saw something too the other day that was talking about how it's not just that we're getting all this information. I mean, it used to be where if you had a question about something, you'd have to go to the library, look it up. And now you can go online, and not only are you going to get the answer to whatever your question is, but then you're going to have like 18 different branches off of that, of directions that you can go with other information.
Right.
And even like with the news, we don't have to wait for the news to come on at night. We can go to any resource to find what's happening everywhere all at the same time. And so you're inundated with all of these, maybe we could call them micro traumas, an inundation of micro traumas. And so that inundation, like if you don't have the coping skills to handle it, that could be a precursor to it too.
Mm-hmm.
So when we talk about media, what are we talking about? It's not just phones or television. What else?
Right. I mean, it could be even our Kindle, even, like we use that for reading our books. And so there's two different types, right? There's interactive screen time and there's passive screen time.
Mm-hmm.
So passive screen time is just watching television or movies. You're not really interacting with that.
Mm-hmm.
And then, the interactive part is probably, video games or just touching the screen, a console. Those things are
clicking 500 times on the next YouTube video.
Yeah, that's right. So that's interactive. And like, I said, that's the overstimulation part of the brain. And I think what we tend to forget too is that the screen, the blue light on the screen mimics that of the sunlight. And so let's say, why can't I sleep at night? Well, what time are you turning off that screen? Because the pineal gland of the brain is the one that releases melatonin. And if it sees that you're looking at that blue light and it says, well, I think Amanda still needs to do some work, so I'm not going to release that melatonin to help her sleep.
That's why they say if you need to sleep, go camping.
Oh, really?
I heard that. Go camping for a week and you'll get your sleep cycle back on track because you don't have, well, obviously you can take your electronics with you camping too, but especially if you go in an RV. But if you go like simplistic camping, that's supposed to reset your, melatonin and all that sort of thing too. So if we have all of these things that are affecting us, are there any other things too that might be affecting ADHD?
I mean, the typical depression, anxiety, when you have that always has like difficulty concentrating part and restlessness. So if understanding, is there another like psychological disorder that can exhibit this? Reactive attachment disorder in children because of not having that secure attachment with their parents, can cause that as well. So
and reactive attachment disorder often has to do with like poor emotional regulation. And so if you can't regulate your emotions very well, then you're not going to be able to regulate self-control when it comes to schoolwork and staying on task with that sort of thing. So that can also be an issue and stuff too. So what can we do about this? Because most of the time when we hear ADHD, it's probably because we're watching TV and some commercial comes on that says, take this medication. So obviously, there are medications for this kind of thing. Do you want to share a little bit about the medications and stuff that are often diagnosed?
Yeah, sure. I mean, commonly prescribed is like Ritalin, right? Ritalin and Adderall. You have Concerta, different forms. So there's two categories. There's a stimulant and then the non-stimulant like Strattera. Sometimes we give guanfacine, which is really an antihypertensive, but it's in the category of non-stimulant. But really the main thing when the patient's children come to me, I would have to really address like, so what's your overall goal? Like, what would you like, right? Because a lot of the parents are kind of hesitant in starting their children on medication, rightfully so, because of the adverse effects.
Yeah. And I was going to say something too, you should probably share a little bit about, I know some people are starting to become aware of, because I used to work in substance recovery, and I worked with meth addicts, and I think more people know nowadays that those medications are what?
Meth.
Amphetamine. So it's not the exact same as meth, but it's very methamphetamine versus amphetamine. There are very similar characteristics to those two.
I think the only difference on the street meth is that they add other, ingredients there.
Okay.
Right. This is more of probably a cleaner, right? If you want to look at it that way.
Okay.
I mean, the most important thing to understand is like, what would you like out of this, right? And so I see adults and I put them on like an Adderall because they're having difficulty focusing, right? But I say to them, you also want to take advantage of this drug in a sense that you need to develop structure. You need to develop routine, regularity. because our brain does not like disorganization. It just doesn't function. That's why hence we have ADHD, right? And so, and that's what I encourage them to do, is because when you do, over time, this drug is not really good for our body, right? We know the adverse effects of these things. And so I think realizing what is the mindset, what would you like out of it? And is your intention and goal is also eventually long-term to get off of it, but already developing these habits.
That's one of the things I like about working within our practice is the goal is always to give people something else versus just medication so that they don't have to rely on that the rest of their lives. Obviously, we do use medications and stuff here, but we're always trying to give people something else that is more sustainable versus just the medication and stuff. So maybe we should talk about some of the side effects of the medications, because from what I know, I mean, I don't prescribe, but I know that some of these medications, the side effects are actually the same as the symptoms that they're coming for. So do you want to share some of that?
Yeah. So for, the stimulant drugs like Adderall, Ritalin, common side effects are insomnia. It's an appetite suppressant, so people sometimes like that if they want to lose weight, but it can also cause some anxiety. It can also cause, aggression.
Yeah, I was going to
irritability,
say,
anger, which you're like, oh no, But yeah, those are the really top, probably 10 or 5 symptoms. That's what I tell them. And also somnolence, like people are just sometimes, actually that's Statera. Somnolence, right? You're so tired with the medication as well. So.
Yeah, I remember working with a kid once who was taking the medication because he was seen as more hyperactive in the classroom. And after he had been taking it for some time, he was, there was a lot of aggression towards his siblings and that sort of thing. And we actually talked about, seeing what he would be like without the medication. So they got permission from the doctor to try it, and his behavior changed and he was no longer aggressive anymore. And they decided that, it was better for him to be a little more hyperactive than to be aggressive towards his siblings and stuff like that. So I like that you ask, what is the goal? Because that helps the parents or the person who's wanting help to know, oh, okay, this is what I want. Well, this is what I'm likely to get out of this, prescription or practice versus, oh, that's not what I want. I don't want that. So maybe another course is more beneficial.
Yeah, because remember, you have to also consider the half-life of the drug. It wears off. Let's say if you do a Ritalin immediate release, it wears off probably within 2-3 hours. And then the rage is there because like the body's like, it's shocked that it's losing that ingredient,
Yeah.
And I think what also sometimes we look at ADHD just more on a negative note, but really with ADHD, you hyper-focus. So you can focus on a task, right? And complete it. And then also the creativity part, they're hyper, but they're also in a sense creative. So instead of looking at it all as a negative, there's positive things.
And I'll tell you, there's no energy like somebody who has ADHD, the hyperactive type. They can get stuff done where I'm like, I'm tired. I don't have any more energy. And they're like, I'm just getting started. Let me go at it and stuff. And sometimes they work better in more active roles too, that they can actually get out, which speaks to what are some of the things that we can do besides medication to help people?
So, I mean, we have the Choose Life acronym, and that's what I share with my patients, that, it begins with that exercise every day, right? Having that at least 15 to 30 minutes starting off if you're not used to it, and then building that up. Regularity of sleep, man, that's number one. Yeah. In our Choose Life is sleep. Super important to get at least for adults 7 to 9 hours, and then children more than that. And then being able to have a healthy breakfast. Have your ground flax seeds because they're high in omega-3s and 6 that helps us stay focused and concentrate. Yeah. What else? So decreasing that screen time. I know when I say this to my adolescent patients, and with their parents there, the parents are like nice and happy looking at me, but the children are like, oh, she's evil, you know? And I was like, so
I've had that look before. I know what that's like.
But
and I even have to preface it. I know you're probably not going to like to hear this, but this is going to help you. And then the parent goes, I have to enforce this though. And then the kid's like, I don't want to come here. I don't like her.
Yeah, no, seriously, they don't want to come. But I do tell the children, adolescents, teenagers, I said, well, what do you think will be realistic for you? Like, I don't want you to not comply, but what do you think will be realistic? Do you think maybe 2 hours less? That kind of bargaining situation. Sometimes they like that, but sometimes they just like, no. I don't like any of those, But what I like about this book that you actually recommended to me is Reset Your Child's Brain by Dr. Victoria Dunkley. And what I like is that before she prescribes anything to her children patients, is she would actually ask the parent, are you willing to put the child on a 4-week plan on an electronic fast? And the parents, like, you made that face, you're like, are you serious right now? And but it really has been proven in her practice that to decrease meltdown, improve their grades, their attitude, their interaction. So what I tell my parents is that when you remove something, you got to replace it with something better. You can't let them be bored in any way. That outdoor activity, the interaction, connection, relationship is very important, because we don't want to use these electronics for a babysitter.
Yeah. And oftentimes too, parents struggle with giving it up themselves. But if they put it down, sometimes it's easier for the kids to go, oh, okay, well, mom and dad are putting it down, so maybe I can be without it too. But that's not for the first several days at least. You're going to get pushback. Oh, yeah. But I always like to tell parents, it may start out difficult, but kids are actually quite resilient if you stick with the plan, and they will start to jump on board, or at least not be so resentful after a few days or so with that. I actually just read a study recently too that said one of the best things for kids with ADHD is actually playing outside in nature. And so they get a healthy stimulation without all of that, light stimulation. And I think too, this is for you teachers out there. I don't know how many of you have a multi-million-dollar budget to deal with in terms of like teaching your classroom. And so unfortunately, a lot of kids, spend a lot of time on these very well-paid forms of entertainment. And so when they get to school, how are they supposed to pay attention when the teacher's got like a very minimal budget to engage the children, and they're used to these very high impact, bang, bang, interactive sort of, entertainment? How's a teacher supposed to compete with that? So you're actually giving your child the best benefit by making it more neutral to what teaching is going to look like in the classroom too.
Yeah, and I think that's what I usually tell my parents is that, if you want me to even talk to the teachers so that we're all on the same page, and this is where team effort comes in. The saying, it takes a community to raise a child. That's very true. And so it's really important for us to realize that, the teachers there, as parents, as providers, we're all wanting the success of the child, because eventually that child will be part of the society in the future. And think about a society where, it's functioned on electronics. Yeah. I don't know what that looks like, honestly, because I'm in that middle part. So it's really going to be hard if we're just so focused on it. I'm seeing more so too of children even being prematurely diagnosed with ADHD and even autism, where it's actually, there's a term called virtual autism, where they mimic the same symptoms of autistic behaviors, but they're really not autistic when you remove those electronics from their presence.
And I think that goes back to, what I heard about the news. If you're incessantly inundated with all these things happening in the world, how do you maintain that very youthful, innocent response to it if you're constantly being inundated with bad things? There's a certain desensitization that happens in order to function in a world with all that stuff jumping out at you. And so that's the autism. Maybe we'll have to talk about that sometime
Later.
too.
Mhm.
But
Yeah.
so I think all these things are really helpful. Anything else that we
Mhm.
can keep in mind in terms of helping children and maybe even adults too that have been diagnosed with ADHD?
Yeah, so with adults, I actually highly recommend them to read books.
Mm-hmm.
There's one on thriving with adult ADHD, and then there's overcoming distractions. And so, like, being able to understand what tools you can develop
Mm-hmm.
and realizing that, if I can do things on the lifestyle realm, right? Because it's a patient and provider relationship. I'm
Mm-hmm.
not just going to continue giving to you and you're not willing to take, or not willing to provide as well. So I think I really encourage and empower my patients that you can do this. You can develop this structure. You can develop this routine. It will take time. It is hard because we're not used to it.
Countercultural.
Right? It's countercultural. Yeah,
Mhm.
that's right. And, even having an accountability partner
Mhm.
and, providing I know there's apps that actually can help you decrease your electronic use or something of that nature to
Mhm.
hold you accountable. But I think these things are really important to have,
Mhm.
in everyday life.
So we've talked about taking away certain things. Anything else you'd suggest adding in terms of, because I don't want us to sound like we're so anti-media that
Oh, yeah.
although we are in I just want to be honest. There is some difficult stuff that happens with too much media. But what are some positive things or things that we can add to a
Mhm.
child's life or an adult's life that might have ADHD that would also be beneficial to focus on?
I think really providing that freedom of creativity for them,
Mm-hmm.
that space of being able to explore things, right? And do things that probably they used to like to do, but maybe stop doing,
Yeah.
knitting, right?
Okay.
Painting, anything that really provides that hyperactivity and creativity part,
Mm-hmm.
where they can release that energy, that part of them, and realize that it's okay,
Mm-hmm.
and that's what I tell my patients who are on these drugs. I want you to take a holiday
Yeah.
off where you're not on it. And so that
Mhm.
you can, because one patient was telling me sometimes it's hard for me to connect, with my wife or husband. And so I'm just like, okay, well, take that holiday off so that you're yourself. Yeah, one
Mhm.
individual was like, yeah, I feel like I'm not myself. So and even though he works 5 days a week, I only give it for 4 days because he wants to be himself on the weekends.
Mm.
So
You can
Yeah.
actually do medication, a certain number of days and then go off of it and then go back on and stuff like
right.
that.
When you
Okay.
are just really needing to focus at that moment and complete
Mhm.
the task.
Yeah.
So
I some other things I'm thinking of
Yeah.
too is like a schedule.
Yeah.
Having a schedule. I know when I worked with the kids, like they were much better. They didn't always like the schedule at first, but once they got used to the schedule, then it
Mhm.
became very much something that they would refer to. And hey, how come you weren't here at this time? And I'd be
Mhm.
reminded of those things. And I'm like, yeah, the schedule is really important when
Yeah.
they're relying on that. But it's great for kids with ADHD. Sometimes even having, little reminders or something. I know
Mhm.
some of my kids, especially the younger ones, I'll even have give them a little card that they can put on their desk with 3 things to remember. I want to stay focused today. I want to be nice to others and I'm going to be honest, especially when they have some impulsive behaviors and stuff too. But even I think one of the best things that parents can do is even just spending time with their child, because sometimes what looks like ADHD could be some kind of anxiety or something. Maybe
Mhm.
there are changes that are happening in their lives. And
Yeah.
maybe, when we're busy, it's hard to know those things are happening. So having that set apart time to get to
Mhm.
know your child and understand what they might be going through, listen to their hopes and their dreams when they're
Right.
little and that sort of thing. Listen to what might be happening at school. There's things that we don't think are fearful, but for a little kid, those can be very scary for them. And just talking them through that, I think that's one thing that we're missing more and more of is that connection to teach them
Exactly.
it's okay to connect too. And I think that might be also another thing, that social anxiety can be assigned or can look like ADHD as well, because I don't know how to interact with people.
Exactly.
And that sort of thing too. But I so appreciate you joining me today.
Thank you for having me.
Just to recap the things that we covered today, we talked about the diagnosis of ADHD and what are the symptoms of both inattentive and hyperactive, or combined. We talked about some of the things that might contribute to ADHD. We talked about medication and side effects even of the medications and everything. And then we also talked about things that we can do to help our children and ourselves when we think we might have this diagnosis or have some of the symptoms of it and stuff. And so I just want to thank you for joining me and
thank you
for sitting here with me. And I hope everybody appreciated learning a little bit more about ADHD.
Yes.
Thanks for listening. To hear more episodes, find us on social media, or support us financially, visit thebrainpeoplepodcast.com.